Hi, and welcome to the first session for AS, Health and Social Care and Childcare. The date of the examination for Unit 1 is Thursday, the 16th of May. In this session today, the aims are to look at the definitions of health, the definitions of well-being, and also the three models of health. Okay, so there are three definitions of health. In class, we look at these as the positive definition of health, the negative definition of health, and the holistic definition of health, hence the code PNH. You will need to understand, obviously, the meaning of these different types of definitions and also be able to provide examples. So if first we look at the positive definition of health, this is where we are achieving and maintaining physical fitness and mental stability. Therefore, we may be exercising, we may be eating healthily, we may have obviously good happiness, so we are happy, and also we can control our body weight. We then have the negative definition of health, which is the absence of physical illnesses, diseases, and mental distress. Therefore, somebody would classify themselves as being healthy just because they do not have an illness, disease, or any mental problems. An example of this would be when an individual believes that their health is in good condition because there's nothing wrong with them. Therefore, I'm healthy because I have no illness or disability. Maybe this person smokes, for example. Maybe this person takes recreational drugs and maybe drinks heavily. However, because they have no illness or disability, they believe that they are healthy. The holistic definition of health then is based on a complete physical, mental and social well-being rather than the mere absence of disease or infirmity. So this definition of health obviously looks at different areas of physical, mental and social well-being, and that these need to be balanced and equal in order for somebody to have good health. An example of this is when all a person's needs are being met, all aspects of personal needs that include psychological, physical, social, emotional needs should be considered as a whole. Okay, so what you might get then in an examination question is something that's just come up on the screen now. So Mr. Williams believes in the negative definition of health and well-being based on him feeling healthy and living without disease or illness. Mr. Williams has been a smoker most of his adult life and doesn't think that this has an impact on his health. Describe how knowledge of the positive and holistic definition of health and well-being could help Mr. Williams to improve his long-term health and well-being. So in this question now, we need to address, obviously, describe how knowledge of the positive first, and then afterwards describe how knowledge of the holistic. So if we were to look first at the positive definition, this is obviously achieving and maintaining physical fitness and mental stability. If Mr. Williams then could be perhaps a little bit more proactive in looking after his health and well-being, this would help him at present and also in the future. The positive definition means that Mr. Williams makes the effort to improve his health and well-being by adopting a healthy lifestyle, e.g. with his diet and with his exercise. And the positive definition means that Mr. Williams uses perhaps screening and vaccination programs to try and improve his health and to take advice about health issues like giving up smoking. If we then address the second part of the question, we will look at the holistic definition. So here, this is a state of complete physical, mental and social well-being rather than being absent of disease or infirmity. So again, Mr. Williams can consider all aspects of his pious health and well-being and the spiritual elements also. The holistic definition means that Mr. Williams takes care of his mental health. So, for example, he maintains regular social contact, he's aware of support groups for depression and anxiety, and also he could seek support group from people who are also giving up smoking. The holistic definition then also considers the whole individual and how they interact with the environment on approach of life. And this obviously will consider mental as well as physical and well-being aspects. Okay. Now we will look at the definition and concepts of well-being. Okay, now there are three definitions of well-being as well as three definitions of health. So the definition that we will look at first is a person. Okay, so the code that I have here is PAC because we have well-being of a person, we have well-being of an adult, and also well-being of a child. So for the code then with the definition of well-being for a person, I have SSEEPPFC. Okay, for this reason, we will be looking at how an individual's well-being is affected by their social and economic well-being. This then relates to how they contribute to their social life, and that perhaps they don't live in poverty, and that they can work, and they can also live independently, and if needed, have support through the medium Welsh. Now, these are just many of several examples that we could use to understand how somebody's social and economic well-being will improve if obviously we address these examples on the whiteboard. Okay, so the next one we were going to look at is also an S. So if I am a person, is my suitability of my living accommodation appropriate to my needs? So here we could look at, does an individual have a home that helps them ensure their well-being? So is the home warm? Is the home free from damp? Does the home have the correct resources? Is the home suitable for the amount of people living there, and also is the home suitable for that person's needs? So for example, I could have some physical needs and I might need adaptations within the house to help me fulfill my well-being. Then we will look at the first E. Okay, so if I am a person, I would need to ensure that I have education, training and access to leisure activities. This obviously will enhance my learning and development. I can decide to do the things that are important to me, and also I can have some leisure time to maybe let off some steam, be in a different environment, and obviously do something that's important to me and that I enjoy. If we look at the next E then, obviously every individual needs to ensure that they have their rights and entitlements met. So are individuals aware of whether their voice is being heard? Can they make a valuable contribution to the decisions, obviously, that affect their lives also? And also, are individuals' circumstances taken into account? And therefore, some individuals obviously will have more or different rights and entitlements to others. We then have our first P, which is protection from abuse and neglect. Obviously, whoever we are, whether we're a child, whether we're an adult, we need to have protection from abuse and neglect. So again, is my voice counted? Okay, do actually people listen to what I'm saying? Can I seek the correct support because of obviously issues that arise? Also, can I protect the people that I care about? by making sure they have access to the correct services. Okay, the next P then is, do I have physical, mental, and emotional health? Okay, so am I healthy? Am I active? I can do things to keep myself happy and healthy, and also I get the right care and support. Our F then stands for family and personal or domestic relationships. So can I make correct choices in terms of what I do in my spare time as an adult? Do I feel that I belong to a network of people? Can I contribute to safe and healthy relationships? And then if we look at the last aspect of a person, the C is the contribution that I make to society. Can I engage with and contribute to my community? And am I a valued member of society? Okay, so those are the 8 aspects that obviously contribute to the definition of a person's well-being. If we look then at the adult definition of well-being, this is where an adult has management and control over everyday life. So can they make good lifestyle choices? Can they deal with stress? Do they have a good work-life balance? Can they take medication as needed? And also, are they part of healthy relationships? So the adult definitions of well-being is an extra to a person's definition of well-being. Okay, so you may have a question that is asking you for a person, but then gives specific reference to an adult. Now, these are the 2 extra pieces of information then that you would need to add to that answer. Okay, also taking part in work. So as an adult, they should have the right and obviously support to be able to take part in work if appropriate. This obviously will give them a purpose. They will obviously have money, so they won't be suffering from poverty. It will keep their brain engaged. It will give them a value, a responsibility, and a purpose every day. And then if we look at the children's definition of well-being, this is where a child then has their physical, intellectual, and emotional, and social and behavioural development enhanced through opportunities. So their well-being obviously would need to ensure that they grow, they develop effectively, that they are engaged in school, that they can solve problems and make decisions, that they can control their emotions, that they have friends and activities to attend, and also they have good role models in terms of how they can base their behaviour around. Okay, so again, these would be additional pieces of information to a definition of an individual. You might get questions asking you to define well-being with specific reference to a child, and obviously these are then the extra pieces of information. So this is a question that we've been given in prior papers. So outline the meaning of well-being with specific reference to children. Okay, so in this answer then we would be looking at the double S, double E, double P, F, C, because obviously this is a person. Okay, I've given different examples here based on a child. So they could have social and economic well-being by having opportunities to play, meet friends, and interact. The suitability of their living accommodation. Does the child have shelter? Do they feel warm? Do they feel safe? Do they have education in terms of do they attend school? Do they attend training and leisure activities, college, etc.? Do they have a voice, and is that voice something that somebody listens to, and do they feel empowered because of it? Do they receive love, and are their needs being met from abuse and neglect? In terms of physical, mental and emotional health, do they have access to services? Are they free from illnesses? Can they go out to the local park and play, for example? Their family and personal and domestic relationships then, Is this a loving and supportive and secure environment for them? And also, do they make a contribution to society? Do they respect their local area? Do they participate in activities? That is obviously around them. Now, on top of this information then, of course, we need to make sure that we give reference to the physical development. So can they grow? Do they develop? Are they free from disease and illness? Intellectual, in terms of do they have access to school? Do they have the resources? Can they read, problem solve? Do they have memory skills and language skills? Are they happy? Can they show emotion towards others? Are they having friendship groups and interaction opportunities? And obviously then can they manage their own behaviour through effective role models? Okay, so this is just obviously a model answer for you to consider and the options available when addressing a question similar to this in the examination. Okay, so also a 3. So we've had 3 models of health, we've had 3 models of definition, and we now have 3 models of health, disability and well-being. So this being the social model, the biomedical model and the biopsychosocial model. And we will look at these in terms of BBS. Okay, that will be our code. And hopefully by the end of this session, you'll have a better understanding, obviously, of the 3 different models. So our first B being biomedical. So the biomedical is probably the most traditional model that we have experience from. This is based on the fact that maybe we have something wrong with us, we go to our GP surgery, we expect to be diagnosed and we expect to be treated for something that is biologically wrong with us. Obviously, this has come on leaps and bounds over the years due to advancements in technology, and therefore the medical care can obviously make a perhaps more accurate or earlier diagnosis, and then obviously we can cure and treat the disease before perhaps any further problems occur. It's been obviously evolving for many years. Medical science has obviously great advancements, and a perfect example of this is our vaccination programme, especially with COVID. And obviously we were racing to try and find that vaccine that would help us lessen the spread of the disease. And you could arguably say without those technological developments, this would never have happened. The emphasis basically is based on the professional worker to make that diagnosis and make an accurate diagnosis to then provide treatment to improve someone's condition or lifestyle. This is obviously very demanding in terms of financially demanding. There's lots of tests perhaps that need to happen. There's lots of medication being prescribed, and there's lots of different types of treatment. And normally with this model, you don't get the individual taking much responsibility for the problem themselves. They just appear and expect to be fixed as such. And this model obviously is a replica of that. Now, if we look at the biopsychosocial model, this model of health then incorporates the 3 areas. So obviously the bio being the biological, the psycho being the psychological, and also the social being the social side of a problem. Okay, so the biological is perhaps something that we can't control. This is our genetic makeup. This is perhaps the history that we have within inside us. The psychological then obviously includes our emotions and behaviours, whether we've perhaps been an individual who has suffered adverse childhood experiences, for example, and this is perhaps how we cope then with different scenarios and how much resilience we have. And then the social side of it could be related to our environment, where do we work, where do we live, our family circumstances and money. Now with this model, it's perhaps sometimes an issue to work out what the exact problem is. So for example, I could be an individual who's had a stroke. So for example, I could be having difficulties with my speech. I could have difficulties with moving, and then obviously then this will impact maybe the social side in terms of I can't communicate with people, I can't go to work, maybe my mobility is preventing me from walking very far. So you've got 3 areas of problems, and obviously try and find which problem perhaps is causing the most amount of concern to an individual can be hard with this model. However, if you're looking at maybe improving an individual, then by looking at the 3 aspects of this model, you're able to have a balance of how things work. Now, the social model obviously just looks at the social aspects, and here you have maybe more responsibility based on the individual taking control and making decisions of factors that's affecting their health. For example, I could be living in an area that's not contributing very good to my health. Therefore, I could decide to move from that area. Okay. This could be a problem with that my job perhaps doesn't pay particularly well, and I am fortunate and left to seek a job elsewhere. Okay. The difference is that individuals or opportunities that some individuals have at the beginning of their lives is not perhaps a true reflection of where they're going to be at the end of their lives. So this means that opportunities and our social health perhaps deteriorates as we get older. So this means that we have poor health and well-being outcomes are much more likely, and could include then us living a shorter life because of obstacles that we may face compared to others. The social model gives us gives us responsibility in terms of the decisions that we make. And obviously there's a result of social barriers that it makes it difficult perhaps for disabled people to achieve their full potential. Now, I fully appreciate there that we have no choice whether obviously we're a disabled individual. However, I could perhaps be more proactive in terms of seeking support. I could be more proactive in terms of make better choices of where I'm able to go and to make better use of those places, rather than perhaps deciding, oh, I can't go there, so I'm not going to go anywhere. And it gives us a little bit more control over our health and well-being. The social model obviously places a strong emphasis on the need to intervene early. So we could be looking at an individual who is going to lose their job, okay, and perhaps potentially suffer from poverty, maybe not have a roof above their heads. So in this situation, we need to try and intervene early and perceive that some problems are going to arise if situations actually occur. The model tries to reduce social differences, and it tries to offer something or similar opportunities for everyone. So this obviously could be based on gender, ethnicity, obviously how much income they have, where they live, and perceive these problems and try and offer solutions to these individuals. The hope is that it empowers individuals, and it gives them maybe more training or more education to allow them to gain further skills and confidence and taking control of their problems, and participate in healthy behaviour. Okay, this is an example then of how we could look at an examination question. So there are several models of health, disability and well-being. Contrast the social model and the biomedical model of health, disability and well-being. So here you're looking at 5 to 6 marks, so 6 obviously being the top mark. In band 3, then, we would expect a very good response, which considers a range of features of the social model and the biomedical model of health, disability and well-being, which clearly illustrates the difference between the 2 models. So you obviously need to address both of them equally, rather than, oh, I know perhaps a lot about the biomedical model, this is what I'm going to talk about more than others. It includes detailed considerations of the way in which the 2 models contrast each other. Okay, so first of all then, I am going to look at the initial one of the biomedical. Okay, so it assumes that illness or disease exists, and there is an emphasis on clinical diagnosis and medical intervention in the treatment or disease or its symptoms. Okay, so i.e., we will find out what's wrong, we will make a diagnosis, and obviously treat the problem. The biomedical model then obviously emphasises treating individuals separately from their lifestyle or living conditions. So they focus on the disease, illness or disability, and help to restore the individual to their pre-disease state. So, for example, I could have maybe a medical problem based on perhaps smoking. However, this model will look at what is wrong with me because of smoking rather than helping me to give up smoking. Okay, so the reason for the disease are not the basis of the biomedical model. That does not interest this model at all. Okay. The biomedical model does not promote a healthy lifestyle if an individual lives in an unhealthy life without any adverse effect. It should continue, while then obviously the social model tries to proactively encourage individuals to live a healthy life. And obviously here you could say that the emphasis is based on the professional practitioner in the biomedical model, whereas with the social model, this is based on the individual making the correct choices. Obviously now we need to give a little bit more information in terms of the social model. So here you could talk about barriers in society, the impairment or what makes them different from them excludes individuals. Barriers can be physical or also based on attitude. Excuse me. So barriers can make life more difficult for individuals, and perhaps these barriers that they can't always control. So the social model tackles wider health issues by using a community approach to prevent disease. So the social model goes beyond lifestyle and behaviour and encourages the need for social change. And this obviously could be based on people's attitudes towards how they live their lives. The social model is based on the idea that social, environmental and economical factors must be engaged or changed in order to make improvements. The biomedical model assumes that health professionals will be able to treat the illnesses or diseases, and the individual will take a passive role. Okay. So the past two slides have given us a good understanding of how we can contrast these models. Okay. Now it's definitely worth you revising maybe the advantages or disadvantages to both types of models. For example, the social model will consider many different aspects of an individual's life. However, this can get quite complex, and then sometimes we don't know what target or what problem to target first. And whereas with the biomedical model, then we could look at, it's a little bit more straightforward because somebody comes with a symptom, we try and treat that symptom, and it's not maybe many factors that are contributing to someone's problems. Okay. Now, if we just look back at what we did at the beginning of the session, the definitions of health there, okay, obviously there are three definitions of health. This is our positive definition of health. We have a negative definition of health and also a holistic definition of health. The terms of definitions of well-being, there are three. So we have a person, and the person has 8 factors contributing to their well-being. We then have an adult, and they have 2 factors contributing to their well-being, and obviously the ones connected with the person. And then with a child, that is then their pies and also the 8 factors of a person. Okay, The 3 models of health is BBS, as we've just more recently discussed, and obviously being confident in the strengths and weaknesses of those 3 models. I hope this has helped your understanding of the session today, and look forward to delivering the second session for you. Thank you.